You wake with a sharp pain tearing through your body. Your skin is slick with sweat, yet the air around you is cold enough to sting your lungs. Something metallic fills your mouth. You hear murmurs you don't understand, feel rough hands holding you still. A knife flashes near your skin. There is no explanation, only fear, only pain, only the certainty that whatever happens next is out of your control. Illness in the medieval world was not a private experience. The moment the body failed, it became a public problem, one that drew family, neighbors, clergy, and healers into the same small, airless space. Sickness unfolded in rooms heavy with smoke, animal smells, damp wool, and unwashed bodies. Fever meant delirium. Infection meant rot. Injury meant blood that did not stop. People did not fear illness because it was uncomfortable. They feared it because it so often led to helplessness, social exposure, and death. The medieval understanding of the body was built on balance. Health was believed to depend on the harmony of internal forces, hot and cold, wet and dry, shaped by food, weather, emotions, and moral behavior. When illness struck, it was rarely seen as random. Something had gone wrong. The body had fallen out of order. The world itself might be out of alignment. Sin, divine testing, bad air, corrupted food, or hostile stars could all play a role. To be sick was to be vulnerable not just physically, but spiritually and socially. What people feared most was not pain alone, but uncertainty. A cough might fade, or turn into something that consumed the lungs. A small wound might close, or fester until the flesh blackened. Childbirth might end with new life, or with silence and blood soaking into straw. There was no clear boundary between the recoverable and the fatal. Every illness carried the weight of possibility, and once the body weakened, the mind followed. Care did not come from a single profession. Medieval medicine was a layered system, shaped by class, region, and necessity. Learned physicians studied texts and theories, often serving the wealthy. Barber surgeons worked with their hands, cutting hair, draining abscesses, setting bones, and amputating limbs. Monks preserved medical knowledge, tended the sick in monastic infirmaries, and blended prayer with practical care. Midwives guided women through pregnancy and birth, relying on experience passed from one generation to the next. Folk healers used herbs, charms, and rituals rooted in local tradition. These roles overlapped, sometimes cooperating, sometimes competing, all operating within the same fragile understanding of the body. Bloodletting was among the most common treatments, and not because people enjoyed suffering. Blood was believed to be one of the body's essential fluids, and too much of it, especially if corrupted, was thought to cause fever, swelling, and madness. Removing blood was a way to restore balance. The method varied. Veins were opened with blades. Leeches were applied to draw blood slowly and evenly. The choice of where and when mattered. Certain veins were associated with certain organs. The timing might follow religious calendars or astrological beliefs. To medieval minds, this was not reckless violence, it was controlled intervention. Cauterization followed a similar logic. Fire destroyed what could not be removed. A red-hot iron sealed wounds, stopped bleeding, and burned away what was believed to be corrupted flesh. The smell of scorched skin filled the room. The sound was unforgettable. Patients were restrained not out of cruelty, but necessity. Pain was expected. Endurance was a measure of survival. The body was something to be managed, even if that management was brutal. Surgery existed, but without the relief of anesthesia. Cutting into the body was a last resort, used for fractures, bladder stones, infected wounds, or gangrenous limbs. The process was fast, because speed meant less suffering and less blood loss. Assistants held the patient down. Teeth were clenched or broken. Screams echoed through stone walls. The aftermath was often worse than the operation itself. Infection was an ever-present threat. Survival depended on luck, cleanliness, and the strength of the patient's body. Not all treatments were violent. Herbal medicine played a central role in everyday care. Plants were used to reduce pain, calm the stomach, fight inflammation, and promote sleep. Some remedies had real effects, others did little or nothing. Knowledge came from observation, tradition, and trial. If something appeared to help, it was remembered. If it failed, the failure was often attributed to timing, dosage, or the patient's moral state, rather than the remedy itself. Healing was as much interpretation as practice. Religion was inseparable from medicine. Prayer accompanied treatment. Saints were invoked for specific ailments. Relics were believed to carry healing power. Pilgrimages promised recovery through proximity to the sacred. Illness was not only a physical condition, but a spiritual event. Recovery could signal divine mercy. Death could signal divine will. This belief offered comfort even when it offered no cure. It gave meaning to suffering in a world where meaning was desperately needed. Women's medicine was shaped by secrecy and necessity. Childbirth was managed almost entirely by women, often in the home, surrounded by familiar faces. Midwives understood positioning, timing, and the dangers that came with difficult labor. Yet complications were common, and death was never far. Bleeding, infection, and exhaustion claimed countless lives. Treatments blended herbal knowledge, physical intervention, and prayer. The female body was viewed as unstable, governed by internal movements that could not always be controlled. This belief shaped both care and blame. Epidemics transformed fear into collective panic. When disease spread rapidly, explanations multiplied. Bad air, poisoned wells, divine punishment, or foreign influence were all suspected. Communities isolated the sick when they could, fled when they could not, and prayed when neither helped. Death lost its individuality. Bodies piled up. Rituals broke down. Medical practice strained under the weight of mass suffering. Healers fell ill alongside their patients. Knowledge offered little protection. Wealth shaped experience. The rich could afford learned physicians, private rooms, specialized diets, and prolonged care. The poor relied on local healers, shared spaces, and endurance. Yet wealth did not guarantee survival. Disease did not respect status. A noble body bled the same as a peasant's. Pain sounded the same in any language. Medicine offered hope, not certainty. Regional differences mattered. In parts of the Islamic world, medical knowledge drew from translated texts, hospitals, and a stronger emphasis on observation and hygiene. In Western Europe, learning was filtered through religious institutions and classical theory. Eastern Europe blended local traditions with influences from both directions. These differences shaped treatment, but none escaped the limits of the time. Everywhere, medicine worked within the boundaries of belief and available tools. What is easy to forget is that many medieval practices were not irrational within their world. Without knowledge of microbes or internal anatomy, people worked with what they could see and feel. Balance, flow, and purification made sense in a body that visibly bled, swelled, and rotted. Pain was a signal. Intervention was a response. Doing nothing often felt more dangerous than doing something, even if that something caused suffering. The psychological experience of illness was intense. To be sick was to lose control over one's body and fate. Fear fed pain. Pain fed fear. The presence of others could comfort or terrify. Silence could mean recovery or abandonment. Healing was not only about survival, but about maintaining dignity in the face of exposure and weakness. Medieval medicine was not built from ignorance alone. It was shaped by fear of death, belief in order, trust in tradition, and the relentless need to act when the body failed. It was a system formed under pressure, doing what it could with what it understood in a world where survival was never guaranteed. And yet, even within that fragile system, people did not experience illness as passive victims alone. Being sick in the medieval world meant negotiating with everyone around you. Family members decided when to call a healer. Neighbors whispered judgments about your habits, your faith, your character. Illness exposed the private body to public interpretation. A lingering fever could mark you as spiritually suspect. A deformity could follow you for life, reshaping how others treated you long after the pain faded. Recovery, when it came, was slow and uncertain. Strength returned unevenly. Scars remained visible reminders of survival. A cauterized wound smelled for weeks. A drained body felt hollow, weak, easily exhausted. People learned to live with lasting damage, stiff joints, chronic pain, impaired movement. Survival often meant adaptation, not restoration. The goal of medicine was rarely to return the body to its former state. It was to keep it functioning enough to endure daily life. Medical spaces themselves reflected this reality. There were no places designed purely for healing. Treatment happened in homes, monasteries, workshops, and streets. The sick lay near hearths that filled rooms with smoke. Animals moved freely through living spaces. Waste was nearby. Sounds never stopped. Prayers murmured, tools clinked, footsteps echoed. Healing took place in the middle of life, not separated from it. The body suffered where it lived. Pain was expected. It was not something to be eliminated, but something to be endured, interpreted, and survived. Pain proved that the body was still alive. Silence was sometimes more frightening than screams. Endurance carried moral weight. Those who bore suffering patiently were admired. Those who cried out too much risked judgment. The experience of pain shaped identity, memory, and belief. Death was always present as a possible outcome. Medical intervention did not promise salvation. It offered a chance. When that chance failed, death was not automatically blamed on the healer. It was explained through fate, divine will, or the limits of the body itself. This belief protected the system from collapse. If medicine failed, it did not mean medicine was meaningless. It meant the moment had passed beyond human control. Over time, knowledge accumulated slowly. Observations were remembered, copied, debated, and adjusted. Some practices faded when they consistently failed. Others persisted because they seemed to work often enough. Change was cautious because experimentation carried risk. The body was not a place for reckless innovation. Survival depended on familiarity as much as effectiveness. What remains most striking is not how harsh medieval medicine was, but how human it was. It responded to fear with action. It answered uncertainty with structure. It turned suffering into something that could be addressed, even imperfectly. In a world where illness could erase a life without warning, doing nothing felt unbearable. Medieval medicine was not stupidity disguised as tradition. It was not cruelty mistaken for care. It was a fragile system built from belief, observation, fear, and the constant pressure to survive, working at the edge of knowledge, in bodies that broke easily, in a world that rarely offered second chances. Illness also reshaped time itself. When the body weakened, ordinary rhythms dissolved, days blurred together, night brought no rest, only fevered half-sleep broken by pain and thirst. Bells still rang outside, work still continued somewhere beyond the walls, but for the sick person, time narrowed to breaths, pulses, and the slow waiting for change. Improvement might arrive suddenly, like a lifted weight. Decline often crept in quietly, marked by exhaustion rather than trauma. Waiting was one of the most difficult parts of medieval illness. Treatments rarely produced immediate results. Bloodletting weakened before it promised relief. Herbal mixtures took days to show any effect, if they worked at all. Prayer required patience and faith. The body became a place of observation. Every sensation was examined for meaning. A sweat could be a sign of cleansing. A chill could signal danger. A change in urine color, smell, or taste might be interpreted as progress or failure. The sick learned to read themselves because there was little else to do. Fear did not come only from pain, but from isolation. Severe illness separated people from normal social life. Touch became clinical rather than affectionate. Voices softened or grew distant. In some cases, especially during outbreaks, the sick were avoided altogether. Doors closed, windows stayed shut, food was left nearby rather than handed over. Survival sometimes meant enduring abandonment. The knowledge that others feared your body as a source of danger added another layer of suffering. Children experienced illness differently, but no less intensely. Childhood was fragile and sickness was common. Fevers, infections, and injuries claimed many lives before adulthood. Medical care for children relied on smaller doses of the same treatments used for adults, combined with prayers and protective charms. Parents lived with constant anxiety, knowing how easily a minor illness could become fatal. The death of a child was tragically familiar, yet never ordinary. Each loss carried its own weight. Mental suffering was not separated from physical illness. Melancholy, anxiety, and confusion were understood as bodily imbalances, often linked to excess coldness or dryness within. Treatments mirrored those for physical disease: diet changes, bloodletting, calming herbs, religious counsel. There was no clear division between mind and body. Distress was physical. Physical illness affected the soul. Healing aimed to restore the whole person, even if the methods were crude. During large epidemics, fear reshaped behavior at every level. Ordinary rules weakened. People fled cities, abandoning homes and livelihoods. Others stayed, believing flight invited divine punishment. Medical advice multiplied, often contradicting itself. Some urged fresh air and cleanliness. Others warned against opening windows. Protective measures included fires, perfumes, special clothing, and strict diets. These actions gave people something to do in the face of overwhelming threat. Action mattered, even when its effectiveness was uncertain. The burden on healers during such times was immense. They worked among the dying, knowing they might soon join them. Their tools offered little protection. Many continued out of duty, faith, or necessity. Some refused to treat the infected. Both choices carried moral judgment. Courage and fear existed side by side, not as opposites, but as constant companions. As societies endured repeated waves of illness, medical traditions hardened. What had worked once was remembered. What had failed was often reinterpreted rather than abandoned. Stability offered reassurance. In a world where disease could erase entire families, familiar rituals gave structure to chaos. Medicine became part of cultural identity, woven into daily habits, religious life, and social expectations. When health returned, it did not erase memory. Those who survived severe illness often carried a lasting awareness of vulnerability. The body was no longer trusted. Every ache raised suspicion. Gratitude for survival mixed with anxiety about relapse. Life continued, but with an undercurrent of caution shaped by experience. Medieval medicine existed within this emotional landscape. It was practiced by people who feared death as deeply as their patients did. It was shaped by communities trying to protect themselves with limited tools and uncertain knowledge. It did not promise mastery over the body. It offered companionship and suffering, explanation and confusion, and the possibility, sometimes realized, of survival. And in that sense, medieval medicine was not an aberration in human history. It was an attempt to impose meaning and action on a world where the body could fail without warning, where fear demanded a response, and where survival depended not on certainty, but on the willingness to keep trying within the limits of what was believed to be true. As medieval medical traditions endured, they became deeply embedded in how people understood their place in the world. Illness was not an interruption of life, it was part of its structure. Everyone expected to encounter it repeatedly. Children grew up watching treatments performed in their homes. Blood, wounds, prayers, and remedies were familiar sights. This familiarity did not lessen fear, but it shaped how fear was managed. Suffering was anticipated, prepared for, and explained. Medical knowledge moved slowly because it was bound to trust. Trust in texts copied by hand. Trust in teachers who had survived long enough to instruct others. Trust in practices that ancestors had relied on in moments of desperation. Radical change was dangerous. When lives were at stake, tradition offered stability. A known treatment, even a painful one, felt safer than an untested alternative. In this way, medicine preserved itself not through success alone, but through continuity. What often appears cruel from a distance was, in context, an attempt to act decisively against visible threats. Infections smelled, wounds changed color, fever altered the mind. These were tangible enemies. Cutting, burning, draining, these were physical answers to physical signs. Without an understanding of invisible causes, visible intervention felt logical. Doing something, even something harsh, was a way to fight back against helplessness. Equally important was the role of explanation. Medieval medicine gave reasons for suffering. It linked illness to imbalance, environment, behavior, and belief. These explanations mattered because they allowed people to interpret their pain as part of a larger order. Random suffering is harder to endure than suffering with meaning. Medicine, religion, and tradition worked together to create that meaning, even when cures failed. The system was imperfect, uneven, and brutal. It failed many people. It caused pain in the name of healing. It reinforced social inequalities and moral judgments. Yet it was built by individuals who lived under constant threat of disease, injury, and death. They worked without certainty, without safety, and without the luxury of distance. Their medicine was shaped by the same forces that shaped their lives: fear, belief, experience, and the instinct to survive. In that sense, healing was never guaranteed, but the attempt itself, guided by belief, tradition, and hope, was a way of asserting that life, even in pain and uncertainty, was worth fighting for. If you found this story meaningful, consider liking the video and subscribing. It helps support the channel and allows this documentary to reach a wider audience.